And there it is right there. Can you get that?
Mm-hmm.
Okay. As I go down, then I have some of the social history, different drop downs telling about the patient. And then I have a write-in where I usually put in some personal notes, such as 2 daughters, doing well, 5 grandchildren, was a teacher, enjoyed her, widowed 2 years, still misses husband, kind of thing. Then pertinent negative family history and pertinent positive, physical exam, vital signs, and to try and round out the evaluation, I have the actual pain scale as the 5th vital sign right here. And you have the level mild, moderate, severe, worse. Right here it's listed as none. I'm going to get rid of that. I'm going to put in denied because I want to make sure. It's called scripted speech, and that's where you always ask the patient about pain. So I don't want none. I want denied, that the patient actually told me they didn't have any. Then I have the physical exam with a space where I can also put in findings. So mostly it's pertinent negatives and just basic positives, and then I can go into greater explanation in the little square where I can write it into the top there. Down the bottom here, I haven't incorporated yet, but I have skilled therapy, speech, physical, occupational, just to give an idea of how they're doing there when I do a weekly or monthly, when I do a medically necessary follow-up, let's say it that way. And then we have the drop-down of the different homes I'm in, and we have a level of coding right here, which I'm sure they'll explain to you at the demo. And, of course, nurses that I work with and myself. And that's about it. What's amazing about this is the build-a-note, and I'll show you that shortly. Okay?
So Dr. Hannan is able to show on his note what sequence the complaints or problems are in the billing order, and he's choosing this particular sequence to be number 3 on the note that he is customizing. So problem 4 will show up as actual number 3 on his note for billing purposes. And clicks a button. So this is how a note will actually get produced with the XLEMR system based on all the data. Dr. Hannan.
It changes the template format into a Word format. And that's how long it takes. And we'll pull up. Here is the template that I first started with, and here's the Word note that resolves right here. And then we can read it and we can edit it. Here's the problem: 1, fractured fibula; 2, diabetes; 3, constipation. The hypothyroid, that wasn't really a big problem right now, so we'll just get rid of that number. And 4, neuropathy. And there we have it. We have the assessment plan. What we have here is diabetes type 2 assessment, blood sugars between 100 and 200, continue present therapy and monitor. Blood sugars between 200 and 300, adjust insulin or oral therapy. Hemolytic 75, 25, 16 units QAM. Amaryl 4 QD. Insulin is directed as noted in the note, and SSRI house protocol. Fractured fibula, continue plans for hospital. Monitor for side effects. PTOT, Avalon therapy, splint, cast care, and touchdown weight bearing as directed. Basic information. Here we have history of present illness. We have location, right leg pain, unable to walk, duration 1 to 2 days, context, twisting fall, severity, pain that she can no longer bear, modifying factors, obesity, non-insulin dependent diabetes, hypertension, and CHF.
Great. Now, is there any advantage with this particular system and being as mobile as you are?
Well, that's just it. The simplicity is it's all here and a little printer, and I'm done.
Oh, you got your printer right here on site.
Yep.
Right, you print your note and leave a hard copy on site.
Well, what happens now, I've got that. I'll do markup. I'll do Control P. Make sure I have enough paper. Yep. And I'll hit print. So we can say within 40 minutes to an hour, I'll have a printed note ready for the chart. Oh, I got to hook it in because I was using it as a template. Within, I'd say, usually I'll get the note together within 30, 40 minutes. A lot of these older people have multiple medical problems and multiple meds. Sometimes I'll try and get rid of the PRNs, do some dose reduction. But essentially what I do is get the basic problems in there with the medication so I can follow it and monitor it, and then print out a note within 30 to 60 minutes of having picked up the patient's chart.
Wow. Fantastic. Do you have an opinion on the overall value based on the cost of this particular system, say for a geriatric use?
I think the average price for software out there is $2,000 to $3,000, but it's a database where you've got to lug everything around. You have to go back home. This is the note that comes out. We arranged it so that you have the basic history right here, and right there is actually the clinical decision making right in front of you, so the pharmacist, anybody reviewing the note, doesn't have to wade through the myriad of evaluations that we have to do to meet code. They have all the information right up there in front. And then back here, if they wish to go into personal family history, medical history, physical rounds, and the review of systems, it's all there. So that's it. So within an hour, I can have a note like this on the chart. And what's interesting is when I redo this or revisit this patient, I can re-pull up this chart and adjust it any way I want. Now you're going to say, well, that's just duplicating what you had. Well, no, not really, because I can eliminate, I can change. For example, my billing code is 1, 2, 3, 4, but the next visit I can address the hypothyroidism if I got a TSH, and I can pull that one up and go into greater detail. Okay?
Great. Thanks.